Hi guys. I just kind of wanted to go ahead and get started a little bit because I started thinking about topics that I could possibly talk about, especially if no one leaves comments or has any questions, doesn't know where to start. So how do you get questions and stuff? I start saying stuff that doesn't make any sense. So feel free to leave comments, questions, ideas that you might be thinking of, because I'm going to start off this whole little series. Just what is counseling? Easy enough. And what's the difference between a counselor versus a social worker versus a psychologist? Because they're all the same, right? But they're not. And some of it is what you get into once you get into the field. As a partaker of mental health services, sometimes you don't really know the difference. You just go with whoever you click with. And that's best, because the most important part of a counseling relationship is the relationship. Studies have shown, and maybe I can put some of those studies up linked to this video, that the most important part of counseling, the people that get the most out of therapy, are people that have felt a good relationship with their therapist. So while I might be slightly biased towards counselors, if you go to counseling or thinking about it and are kind of worried about whether or not it's going to work, just remember that counselors are people too, and so it's kind of up to you to decide if you really click with your counselor or not, whether they're a mental health counselor or, like I said, social worker or psychologist or anything. The kind of broad term that I'm going to use is therapist, because I feel like it kind of covers the idea of what we do. So counseling or therapy can be of many different things. The kind of typical, what I think of, what most people probably think of, is going into an office once a week for a couple months and talking to somebody. Usually you start to see a counselor because there's some issue going on in your life, and anybody can go to a counselor, or therapist. Mental illness isn't the only reason to go to therapy. It's just a good place to have that. I'm going to stop that Zoom. I'm sorry, that's annoying me. It's just a really good place to kind of think about your life and to hear some of the stuff that you're saying to yourself. Because a lot of times people just have self-talk, and it's like that's why you have other people read over a paper that you've written, because it sounds one way to you when you're reading over it, but when somebody else reads it back to you, you realize, oh, that's not what I wanted to say, or that's not really what I meant. And that's what therapy can do for you, for friends, for whoever. And so that's why I advocate for everyone going to counseling, but usually you tend to end up going because there's some type of a crisis in your life, which is fine. But yeah, so basically therapy is a way for you to hear yourself better. Sounds kind of weird, but that's what it is. Now, and again, ask questions for clarification, because just like the paper analogy, whatever I'm talking about, it already makes sense to me. And so I need help from you guys to tell me where it doesn't make sense to you. Now, kind of skipping ahead, and we'll talk about self-talk and all that in a different video. But what's the difference between a counselor versus a psychologist versus a social worker? Psychology was started back in the 1800s, a very long time ago. But as a science, it's relatively still young, very young. But psychology was grounded in the medical model. There's a problem, we fix the problem. Very diagnosis-based. Like I said, the medical model, they don't have that contingent like counselors do, which we'll talk about. It's either you have a problem or you don't have a problem. Either you are crazy or you're not crazy. We only deal with crazy people. according to a psychologist. So that's kind of the model that they're coming from. Kind of going along with that, the early models, what you're probably thinking of is Freud, the psychoanalytic model. Something happened in your childhood, and that's why you are obsessed with cleanliness now. That kind of thing. A little later on, about the 60s, came the social work movement. And I might be wrong on the dates, but correct me if I'm wrong. The social work movement, which is still medical model, but it is with the idea that society somehow contributes to individual problems. So how poverty affects mental health, mental illness in this case, how society functions with individuals. And so therefore social workers tend to end up in positions where they are connecting individuals to resources. Social workers are very good with finding resources, with having those connections. So that's them. Most recently, about the 70s, I think, was when the counseling profession came into being. It's still very young, but it is solid, I feel. I'm a little bit biased. It is based on the wellness model, and the wellness model is that wellness is on a contingent, is on a continuous line, with perfect health being at the one end and severe illness being at the other. And no one, just like a bell curve, is at either end, really. Maybe just one or two people out of the whole population. Everyone's somewhere on that line. And so what we do is help people reach their equilibrium wherever they are. Whether you're over here with the most severe illness, to up here when you're doing pretty good, but maybe you still need some help to kind of reach that equilibrium for you. So that's the wellness model, basically. And that's where counselors are coming from. That's why we think that anybody can really benefit from counseling, because no one's perfect. And there's always better ways to do things, or different ways, different ideas for different situations. So kind of in a nutshell, that's what counseling is, that's what therapy is, and kind of how we're different than the other professions. So shoot me a comment, message, whatever, with maybe what you've experienced with therapy, or that's a little bit personal, or just any questions that you have, because I didn't really go into it too deep, because I'm not quite sure really who's watching yet and what you want to know. So that's just kind of a starting off point for us, and I look forward to speaking with you again soon. Thanks.